Welcome to this brief video on the Office of Interprofessional Collaboration with the Rady Faculty of Health Sciences at the University of Manitoba.
The University of Manitoba campuses are located on original lands of Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past and present. We dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration.
Interprofessional collaboration, or IPC, in healthcare has been shown to improve patient, provider, organizational, and system outcomes. There's a growing body of evidence to support interprofessional education, or IPE, in achieving this IPC. IPE is defined as when two or more professions learn with, from, and about one another for patient-centered care. This approach to interprofessional collaboration is also supported by the faculty's strategic visioning in administration, research, and education, as well as our practice partners such as Shared Health and our regulatory bodies.
There are over 600 students every fall who participate in the curriculum that is supported by the Office of Interprofessional Collaboration, which was established in 2015. Representatives from 5 colleges, dentistry with the School of Dental Hygiene, medicine, nursing, pharmacy, and the rehabilitation sciences. This involves 10 programs across 4 campuses: dentistry, dental hygiene, medicine, midwifery, nursing, occupational therapy, physician assistant, pharmacy, physiotherapy, and respiratory therapy. From time to time, we have additional learners from other faculties, such as social work. The curriculum is grounded in 6 competencies for collaboration. These are national competencies recognized by the professions. The curriculum focuses on early learners in years 1 and 2 of their professional programs, providing a very strong foundation around the interprofessional competencies. The curriculum itself is intended to complement other interprofessional education opportunities that take place throughout the Rady Faculty of Health Sciences.
This representative image is of the organizational structure of the Office of Interprofessional Collaboration. It is all run under the oversight of the Dean of the Rady Faculty of Health Sciences. And while the image shows that there are 3 arms of the Office of Interprofessional Collaboration in terms of practice, education, and research, there's much integration and overlap between these 3 different areas within the work that we carry on.
The curriculum is based on these 6 competencies: patient, client, family, community-centered care, team functioning, interprofessional communication, role clarification, collaborative leadership, and interprofessional conflict resolution. Many theories inform the curriculum: how it's structured, the content, the learning objectives and outcomes, learning, teaching methods, the assessment of the learners, and even evaluation of the program.
The global learning outcomes for both years 1 and 2 are based on the 3 different domains of learning, including cognitive, psychomotor, and affective, that you can see on the right side of this slide, also referred to as knowing, doing, and being. The learning outcomes for year 1 are divided between those that focus in specifically on interprofessional collaborative care and those that focus on the health promotion and better health for all and population health. And feel free to pause this video and read the learning outcomes in more detail.
Those for year 2 really focus on patient safety and quality healthcare, which we know is a determinant of health, because healthcare and access to healthcare is a determinant of health. So we take a very careful approach, again, using, the learning domains of knowing, doing, and being, and we weave those within the interprofessional collaborative care competencies. So it's a lovely balance, intertwining of the experiences, so the learners end up being strong within interprofessional collaborative care for patient safety and quality healthcare.
The curriculum that the Rady Faculty of Health Sciences Interprofessional Collaborative Care delivers is mapped out on this slide here. It's a 2-year-long interprofessional curriculum, so longitudinal curriculum. You can see here on this slide that it is divided between term 1 and term 2 and year 1 and year 2. Year 1, we already mentioned, that focuses on population health, and year 2 focuses on patient safety. Each term follows a similar pattern in this curriculum map. The term begins with a synchronous event that is timetabled for the learners in their individual program timetables, followed by a series of interprofessional small team discussions, be they synchronous or asynchronous. Each term ends with an individual written reflection required by each learner about what the experiences have taught them about team-based care in the previous term. We have roughly, as mentioned previously, over 600 students that begin our term every fall, and they're put into one of 79 interprofessional collaborative teams that stay together throughout the 2 years. Every spring, we hold an optional collaboration symposium, which in the last few years has been held virtually. Across the curriculum, we weave the interprofessional collaboration competencies where we focus on team functioning, interprofessional communication, and community-centered care in year 1, and in year 2 on role clarification, collaborative leadership, and interprofessional conflict resolution. And throughout the 2 years, the students are given opportunities to engage in interprofessional practice opportunities, be it in the community or be it in a hospital.
This slide illustrates the growth of the experiences had by 3,117 students by the end of the spring of 2023.
We have a very robust program evaluation strategy determined for our activities. Without going into any detail here, you can see that we do follow what it was originally Kirkpatrick's model that was adapted for interprofessional education. We do consider qualitative perspectives, mixed methods, and evolving opportunities to evaluate how interprofessional education transcends into interprofessional collaborative practice in the practice environment.
We really welcome you to come and join the activities, the excitement of leading and facilitating the future collaborative practitioners within the Rady Faculty of Health Sciences. We have here at the bottom of the screen there the email for the Office of Interprofessional Collaboration. Please connect with us.